Hello, everybody. I am so excited to be here today with author Cheryl Field, and we are going to discuss her book, Prepared, a healthcare guide for aging adults. So, Cheryl, thanks for joining me today.
Oh, good afternoon, Angela. Thanks so much for having me. It's great to see you.
Wonderful to see you too. So, first and foremost, how are you feeling? I mean, your book's been out in ebook, it's out in paperback now. Like, how are you feeling now that you've got the book out there?
It's really been a fantastic couple of weeks. I'm so grateful for the feedback and the conversations that having the book in ebook has inspired. I've seen messages from people, you haven't talked with in a number of years and realize they're in the similar work or they're in an area of healthcare where they really feel and see the value of the book. People have done the download and sent me little messages around this was really helpful. And so seeing the topping of the charts and some of the 5-star reviews has really been heartwarming. It's really helped me to come center back to my why, really why I even embarked on writing the book, which I know we'll talk about. So it's really
It's a
been a
perfect
great
segue, to
couple.
be honest. I mean, doesn't get better than that. So, tell us a little bit more about what motivated you to write this book and how your 30 plus years experience in healthcare contributed to its content.
Yeah. I think we all as humans, we have a sense of our why. And maybe over our opportunity to reflect and think back, it becomes more clear. So I really have always, since I was a little girl, I really always enjoyed helping people. And I think I was 10 and I was kind of sitting with my grandma while, my mom was out running errands. And that moved into a career in nursing where I was a nurse and again enjoyed helping people. Then I moved to a role where I was the leadership and I was training nurses to be better nurses. And even in software, I make tools that nursing leaders use to improve the outcomes of care. Like that's just always been my why. And you ask a great question, like after 30 years experience,
Mhm.
seeing it from the provider side, leveraging my knowledge in regulatory and the forces that impact the healthcare sector,
Mhm.
and then experiencing it for 17 years as an advocate, with my aging parents,
Mhm.
I think I'm in a unique position to really write this book. It leverages my expertise, my knowledge, and just my lessons learned, the mistakes I made as an expert insider. And my whole life, I have answered the phone when someone called and said, this has happened to my loved one or my friend, what do we do? And
Mhm.
I've spent a lot of time guiding them with my knowledge and expertise. So this is really my why at scale. It's really an opportunity to take something that's complex, make it simple, give people some practical, actual things to go do that at scale, I can be helping them. I can't be on the phone with all of them. I'd love to. But at scale, this really helped to take that sense of purpose and that joy that I have in helping people, writing it down in a way that is easily understood and easily adopted to the setting where they're at and be able to help them. So, I mean, again, it just comes right back home for me around my professional why.
I love that. That's amazing. Yeah, I know because I mean, I myself, I'm sure anybody watching right now has had an experience with the healthcare system where they just really wish they knew a little more. They wish you have those afterthoughts like, oh, I wish I'd asked this. I wish I'd thought of this. Why didn't I think of this? And so one of the things I really love about your book is that I find it helps free us from regret because there are when you go through your book there's the step the questions to ask and the things so that it gives us peace of mind knowing that we did all we could.
Yeah, I think what I'm hearing you touch on is the emotion
Mm-hmm.
and sometimes it really is fear and it's uncertainty.
Yeah.
You're right. It's not an area of everyone's expertise. They just don't know what's going to happen when you move into that healthcare setting. They're not experts.
Mhm.
And I also think many of the readers of Prepared are really kind of sandwiched. They're raising their kids and then they're advocating for parents, and at the same time trying to maintain their professional career,
Mhm.
at mid-career status, which is probably mid-level management, an important role where there's a lot of demand. And that brings up that emotion of, you have a lot going on when you have children and a career
Mhm.
and your parents and you're advocating for. If you don't have a system, ready to go, it's exhausting to be researching or trying to find or figuring out. And to your point, that feeling of regret, or just in hindsight, you wish you had known to ask something at the time.
Mhm.
For me, that's the system. Go into the situation having a system that you can at least leverage. And you're
Mhm.
not going to get it all right, but you at least you have a plan. You have
Mhm.
some kind of a strategy to really partner with that healthcare provider. And I think providers have oft also looked at this book and said, "Wow, there's so much empathy for what's happening in the provider community."
Mhm.
And this book really emphasizes the partnership that is necessary for the patient, the provider, and ultimately the payer. All three work together in partnership to achieve the best practical health outcome for that patient. And I think payers and providers are pretty well educated on their own part of the system. I'll tell you what, they don't know a whole lot about each other either. But I feel like patients are the ones that are the least informed.
Mhm.
They're coming in with the least amount of help, the least amount of assistance. And if you don't have a system for advocacy, you really do get lost. And so jokingly, and you'll see the acronym in the book
Yeah.
of bitch, but jokingly, for years I have said, you have to be you really do have to be your own advocate. You
Mhm.
really have to come in. And so that acronym BITCH helps people to remember, first of all, be prepared, which really talks about a real inventory of where you are in your health, your pain, your activities of daily living, your medications, your diet, and your advanced directives, and a health proxy. What do you want for yourself? And thinking about those things, that's the B. You really do want to be prepared and take a little time to reflect. The I is information
Mhm.
and knowing yours, right? You need to be the master of your chemistry, of what's going into your body. Know your information, know where it's at, and know that you have lots of options around connectivity. T is take control, right? That's where we have active roles of advocacy. We talk a lot about that in Prepared. And then collaborate, communicate. We don't always know how to do that.
Yeah.
And it's intimidating. And I'm a nurse in that space. And there's times where I feel intimidated to ask to have a conversation.
Mhm.
And I've put questions right in the book to help break that ice and give you a leading question to feel more confident emotionally when you're coming into that space. It's a highly emotional time when your health feels out of control. it's
Mhm.
it's, it's like, wait. So it brings up a lot of emotions. I think all of us strive to be home, however we define home. And home is, as we get a little bit older, sometimes home is residential, assisted living, or independent, or nursing home. However you define home, we all long to be there. And Prepared is all about staying at home and being ready to master that transition in and out of a healthcare system should you need to seek, those services, which you and I know as people get older, those events happen kind of
Mhm.
multiple times a year. And when we're not prepared, the outcomes aren't the best.
Mhm.
Last night on our local news, we had a terrible rainstorm go through, and there was a town that was flooded. And unfortunately, it was a mobile home community with a lot of seniors. So I'm watching the news and I'm thinking, oh no, they hadn't read the book, and they're coming out of their house with a little tiny bag and they're getting into a raft and they're getting taken to safety, which is awesome. But that's the moment. Those are those sudden changes in, health or condition that happen, that when we're not prepared, when we haven't done part one, when we haven't done be prepared piece, we really get caught into trouble when we enter that healthcare system.
Absolutely. I know in your book, you refer to some of these as oh shit moments, right? And could you provide some examples of, obviously a flooded town is a bit, not everybody's expecting that, but just common, or I guess the most common like oh shit moments that people experience that maybe we think we would see them coming, but we don't.
Yeah, probably the most common in older Americans is falls. And when we're younger, we sort of joke about it, right? We might go to a kickboxing class or getting on and off the floor. You might do burpees as part of your workout, but you reach a certain age in life where getting on the floor is what you try to avoid. You don't want to be down there because you may not get back up. So I think that falls are those oh shit moments that many Americans face. And there's some common causes in homes. Sometimes, unfortunately, it's small pets under feet. It can be those area throw rugs, can be shoes that are loose fitting. These are some common everyday occurrences where now you've had a fall. It's unexpected. And you're not, again, now you need to seek emergency care. Or you at least need someone to come into your home to possibly help you to get up or evaluate something's broken, stitches, those kinds of urgent or emergent type of care needs. And even in the book, I talk about being ready for that kind of a moment. You're home alone and you fall and you can't reach the phone. And by the way, when you fall, your cell phone goes flying. Yeah. You're not getting it.
Or you land on it and it's broken.
So, and it's broken. So how long are you going to lay on the floor or try to get up? A lot of people get hurt trying to get themselves up. But then when you're laying on the floor for hours, first of all, you're in pain. It's a terrible thing to ever experience. The skin begins to break down. There's the need to use the bathroom, which results in soiling. And so thinking ahead for technology, to have that technology in your home, should you fall, where you can call out, into the air and into the space. And whether it's there's all different kinds of technology. Some of them have it on their watch. Some people have it on their phones. Some have the, components with different national vendors. The point is planning ahead for that kind of an event so that you're able to access emergency help when you need it. Actually really greatly impacts the trajectory of that fall. Because if you just fall and bump your head, but right away can get help, you're not bleeding as long, you don't have pressure ulcers, you don't have soiling or skin issues. But if you're really on the floor 12, 14, 18, 20 hours, you have a whole lot of other illness and sequela that's going to happen way worse than just the fall. So again, it's another important component of thinking about being prepared. And then the other piece, of course, is just having most recent information about yourself ready to go so you can take it into that healthcare system. The systems not being as connected as they may be in 3 to 5 years. Maybe we hope, we cross our fingers, but right now they're really not. They're disparate systems. And the data is just not refreshed often enough to be reliable. So you become the most reliable source of that information as you take it into the healthcare system. Car accidents also are occurring, sort of minor moments where you're out and about and suddenly you're being taken into the system. So I encourage people to think about backup systems, right? If you had all your information at home on the fridge or behind your apartment door or, on a thumb drive in your pocket, be able to advocate to a loved one, hey, go to the house, grab this. It's all there. Just tell them where that is. So it can come into that system in an emergency.
Well, that makes a lot of sense. So how can, I imagine that with, being prepared, it can take a certain amount of the fear and anxiety out of going into the healthcare situations. How have you seen that impact the outcome? So if people come in a little more relaxed, they come in with a little less fear, a little less anxiety because they are prepared, versus coming in, frantic and with nothing, no information, not knowing what's going on, not knowing who to call. How does that parlay into a outcome or impact the outcome?
I think the preparation actually is really important part of that. You've had an opportunity to be reflective and thoughtful about what you want for yourself. Mm-hmm. And then when you come into the healthcare setting, you're much more comfortable advocating and asking questions. Trust me, you're still going to be frantic and mm-hmm. feel emergent. And that's when you have to take a breath and sort of follow the program. Be like, okay, it's just like in a fire. Like we practice fire drills mm-hmm. and none of us really ever want there to be a fire. But if one happens at that moment, you're going to feel frantic. And then you're going to say, okay, wait a minute. We practiced this. We talked about this. We're going to get this and this and meet at our safe spot. And let's get out of the house. Mm-hmm. So it's that similar way, except this is a much more complex event, because when you're in the hospital, in the healthcare system, you may be there for days. Mm-hmm. And I think one of the emotions you and I kind of talked about this, the emotion that comes up the most, I believe, is going to be frustration. And frustration is what I feel when I think something should be moving along, mm-hmm. but it isn't. We're stuck or we're waiting. There are 55 million Americans in the 2020 census over age 65. Mm-hmm. And that number goes up every day as boomers age. Every one of those persons needs prepared. And their kids, right? Their kids need to read prepared. To go back to your point, when you're in that moment mm-hmm. and you're feeling that emotion of frustration, right? There's been a change in health status. And so far, we don't know what's going on with mom, mm-hmm. right? And maybe there's 5 kids. Prepared is going to give that family a system. The family, just like the provider, is going to name a key communicator. And then that key communicator, I teach them, set up a group chat on your phone, and only one person in the family communicates with that provider, that hospital, so that you give the hospital a chance to do their work, mm-hmm. get the information, and they'll communicate it back to that one key family member mm-hmm. who then updates in the chat. Yeah. When you know that that's the way information's going to flow, you're less frustrated. That doesn't mean you won't mm-hmm. be like, hey, come on, hurry up. Let's find out what's going on with mom. And then there's on top of that, there's the love and the concern and the sadness when things are happening to people in the family. So you have all of that other emotion as well. But knowing that there's going to be an established system of communication takes out the infighting. Mm-hmm. You figure it out before, not in the angst of that moment when you're like, I should be the one. No, you don't want any of that at that time. Yeah. You want it established ahead of time. And that's when those are just examples of some of the tips to address the emotion that is absolutely going to be present whenever you have a change in health and someone you love. But there's ways to get through it and have better outcomes. So you said, how much is a change for the patient? Oh, heck yeah. Do you think the patient knows when there's 5 kids and they're all fighting over who's calling the hospital? And then the nurse is saying to the patient, you know what? I talked to your son, and then I also talked to your daughter, but then your mm-hmm. other daughter called. Like, those patients don't want to hear that you amongst the family are fighting over who's coordinating for the loved one. That has an impact on the healing and the health and the healing of the patient. So you're absolutely right. There's benefits to the patient and the family when they come in prepared that makes those moments less frantic.
Amazing. I love that. So I think everybody in I mean, Canada and America should be picking up their copy of Prepared, because it's truly helpful for, I mean, not just older adults that could be going into a healthcare situation, but family members, spouses, kids, all that sort of thing. So I really appreciate you coming on and chatting with us today, Cheryl, just to give more context to people.
Yeah.
And
A
it's
couple
amazing.
of things I'll say, it's really a universal concept. I use my expertise, and my expertise is in older adult senior care in the United States, but it's really the human condition when we are without our health, or when our health is in jeopardy, that fight or flight response gets triggered. So it doesn't matter really what healthcare setting or country you're receiving care in. You really should, one, be prepared, think about your information, right? You're going to have your own country codes and laws around privacy and advanced directives. Use those forms, go to those websites. All those kinds of resources are suggested and prepared. Same thing, get organized, gather your information, come in with confidence and control, asking those questions. They may have different names in different countries, what we refer to in the provider side. So my stories and my lessons learned are going to come from a US-based context, but the universal concept amongst us as humans really applies to every country worldwide. So if I kind of think back to my why, I wrote Prepared, was really to help people advocate for the best healthcare outcome worldwide.
Love it. Amazing. Thank you so much, Cheryl, for making time to stop by and chat with us today. I really appreciate it.
It was my pleasure. Thanks for having me, Angela. Have a great rest of your day.
You too. And everybody go out, get your copy of Prepared, a healthcare guide for aging adults. You can get it on Amazon, Barnes & Noble. You can get it just about anywhere books are sold. And I mean, if you feel inclined, buy one for your parent. And
it's also available in large print for your parents.
Oh, yes.
So yes, in 18 font, so that older Americans can read it for themselves and see that large print, not be straining with. So you can get both on Amazon.
Amazing. Thank you so much, Cheryl.
Thanks for having me.